Could this same drug work on people? Researcher Dr. Matt Kaeberlein and cardiologist Dr. Joel Kahn both join us now via Skype. You say this drug is an example of a paradigm shift in terms of how we can treat people and anti-aging. Why is that?
I think that as the field has made a lot of progress in understanding the mechanisms of aging, and we now have a handful of interventions, among them rapamycin, that appear to target the biological aging process, that we will start to see this sort of paradigm shift where hopefully we will spend more effort on trying to keep people healthy longer by targeting the biology of aging rather than waiting until people are sick and then trying to treat them one disease at a time.
Dr. Kahn, you are all about longevity and the things we can do. When it comes to using something like rapamycin, you say not so fast.
Well, I do want to thank Dr. Kaeberlein as the proud parent of many puppies in my house, one of which is in dog heaven now. I wish I could have extended one of those 5 dogs, and I will sign the others up. I know I can only sign one up for the dog aging project, so thank you, Dr. Kaeberlein. You know, I have a longevity center, and I get asked several times a week, can I go on rapamycin? I'd like to live to 120 and act like George Burns the whole way. The question is it ready for prime time? But you know, I'm excited. I just don't think it's now. We have one study with 11 people getting rapamycin over age 70 that looked hopeful, and a bigger study using, they're called rapalogs. They're analogs of rapamycin, because you don't want to jack with something called mTORC2. It can raise your blood sugar, make you insulin resistant. I think there's a lot left to learn. I want my dog to go a little bit on this before I go on it.
I think you make a really fascinating point. I mean, my understanding, and both of you perhaps can comment on this, is that there's a huge community out there of physicians and people taking this off-label already. So I'm just curious about your thoughts on that.
You know, until you study this, we know it does affect the immune system, even at this lower dose of 5 or 6 milligrams once a week or 1 milligram a day. But actually, it's a mixed message because it may actually improve some aspects of immune function in the elderly. You actually will respond more vigorously to an influenza vaccination if you have a little rapamycin in your blood. But there's so many questions about the long-term effects, if there's any aspect on cholesterol, on blood sugar control, which part of the rapamycin activity may actually worsen. So I don't know, Dr. Kaeberlein, you ready to give this to human patients on a more consistent basis?
I think we're pretty much in agreement. I don't have any problem with people who self-experiment, but I also feel like we're not going to learn anything from that. What we really need are controlled clinical trials to evaluate whether or not rapamycin or metformin or intermittent fasting really have significant health benefits in the context of the biology of aging. The one point that I would like to make is I think people tend to be very cautious of a drug like rapamycin because of its clinical history and the known side effects in organ transplant patients taking high doses of the drug. We know that there are side effects associated with high doses of rapamycin. I think what we're learning is that in healthy people taking lower doses of the drug, the risk of side effects is much less, and probably the drug can be tolerated fairly well. But we absolutely need controlled clinical trials to really evaluate whether or not rapamycin is having the effects in people that we see in laboratory animals.
Everyone wants to find the fountain of youth. The reality is there are many fountains of youth, and we know that people who walk regularly live longer. We know in good studies that literally people who eat a handful of nuts every day, they tend to live longer. And I think this is really exciting research, and I'm keeping my mind open towards it. I'm not taking it right now, but Matt, I'm following your studies,
Yeah.
and I may put my dog on it too. And I think it's interesting when you can get smart people in a room talking about something and there is hope. But just remember, watching right now, you can get up, go for a walk, and you are engaging in anti-aging. Every day you're making decisions, a lot of decisions that dictate how well and how long you live. So you don't have to wait for this research to start your anti-aging program right this minute, but a ton of respect, Matt, for what you're doing.
Yes, so
Keep it up, Dr. Kaeberlein and Dr. Kahn.
Portions.
Yeah.
It's all about those portions.
So true.
Yeah, you can
That's your plate size right there.
You can take the best anti-aging drug in the world that is proven to prolong life, but if you eat too much and move too little, you're not going to have as long of a life as you want.